How to treat and cure mucus in stool. Mucus is a smooth, thick substance produced in many places throughout the body, including in the lining of the digestive tract. Mucus lubricates surfaces and allows materials to pass smoothly. Some amount of mucus in the stool is normal. However, significant amounts of mucus and mucus accompanied by diarrhea, pain or blood may signify an intestinal condition such as infection or inflammation. Increased amounts of mucus in the stool can also occur with cancers of the colon or rectum or with bowel obstruction. Inflammatory conditions of the bowel, such as ulcerative colitis and Crohn's disease, can cause abdominal cramping and bloating. Diarrhea is common with these conditions, although constipation can also occur. In addition, blood may be present in the stool as a result of ongoing damage to the intestinal lining. Mucus is used to keep these areas of the body moist and helps to move food through the esophagus into the stomach. It is normal for a small amount of mucus to attach to food moving through the digestive system and be secreted with the stool. However, if a large amount of mucus appears in the stool, this is a sign that the digestive system is under distress. Examining the symptoms that accompany this appearance of excessive mucus can help you determine the underlying cause of its appearance. Causes of mucus in stool. Constipation. Constipation is defined as having fewer than 3 bowel movements a week. This may be caused by an inadequate intake of fluids, poor diet, prolonged use of certain drugs, lack of physical activity, misuse of laxatives and other conditions. In addition to failing to pass a bowel movement, constipation may cause difficulty passing stool because it has become hard, bloating, pain or an incomplete feeling when you eventually make a bowel movement. Infections. There is a large amount of bacteria that help to maintain the balance of microbial flora essential to digestion. If these essential bacteria become overwhelmed by pathogens, it can impact the body's ability to digest food properly. Viruses, bacteria or parasites may enter the digestive system and cause gastroenteritis, leading to inflammation of the intestines or stomach. This infection may also lead to bloating, abdominal cramps, fever, nausea and mucus in diarrhea. Symptoms. Mucus in the stool may accompany other symptoms affecting the digestive tract, including abdominal pain or cramping, abdominal swelling, distension or bloating, abnormally foul-smelling stools, bloody stool. The blood may be red, black or tarry in texture. Changes in stool color or consistency. Diarrhea. Fecal incontinence, inability to control stools. Gas. Nausea with or without vomiting. Painful bowel movements. Urgent need to pass stool. Other symptoms that may occur along with mucus in stool. Body aches. Fever. General ill feeling. Hives. Diagnosis. Several tests can be used to diagnose bowel cancer, including rectal examination, colonoscopy and sigmoidoscopy, barium enema, X-ray, ultrasound, rectal ultrasound, CT scan or MRI scan. Blood tests, including a carcinoembryonic antigen, CEA, test. CEA is produced in high quantities by some cancer cells, especially in bowel cancer. Treatment. Ulcerative colitis. In this pathological condition, the mucous membrane of epithelium lining of large intestine become inflamed, that ultimately result in development of ulcers. These ulcers at later stage start bleeding, and because of such wounds in the inner lining of intestine, production of pus and mucus takes place. This increased amount of mucus is then thrown out of body via stool. Bacterial infection. Naturally, certain amounts of bacteria and yeasts are present in human intestine to facilitate the digestion process. Introduction of foreign particles may cause the imbalance. Bacteria like Salmonella, Campylobacter, Shigella, or Yersinia are the main culprit of the bacteria infection. This pathological condition of bacterial infection can cause fever, diarrhea or abdominal cramps along with increased mucus in stool. Most of the times no specific treatment is required and the situation will resolve on its own but should be monitored continuously. If situation doesn't improve over a period, then it can be serious and need treatment with the help of antibiotics. It is always better to consult physician. Bowel obstruction. Bowel obstruction is one of the commonly found reasons behind presence of mucus in stool. It is associated with severe abdominal cramps, abdominal distension, constipation and vomiting. Bowel obstruction can be because of various reasons like losing gastric hormone balance, low water intake, increased yeast formation. In some cases it can be because of anatomical obstruction and needed to get operated to cure the thing. Irritable bowel syndrome, IBS. As with ulcerative colitis, in irritable bowel syndrome, there is increased production of mucus by the epithelial lining of intestine which is then passed through stools. It has been observed that with diarrhea predominant irritable bowel syndrome, more mucus formation is associated. Crohn's diseases, CD-. There is a lesser amount of mucus production associated with Crohn's disease. Mucus in stool is also associated with anal fissure,